And this is where, with my experience, I can sort of give that 20-year, 30-year picture, where one good thing is that the rush to surgery for tendon problem has much declined compared to when I was a starting doctor. So, in those days, if a physio had seen a patient for 2 months and the patient wasn't better with their tendon, there was this pressure going, maybe you need to go to surgery. And clearly now, I think most folks, well, it depends on the countries, and you have a lot of, listeners from different countries. Um, I'd say that in, you know, the leading sports medicine countries in the world, and that's a value judgment, the surgeons aren't encouraging early surgery because I think they're frustrated because the surgery doesn't work so well. And they just have an unhappy patient coming back to them going, I'm not better. I think much less pressure on tendon surgery than there was over that time span. And I think Jill Cork, Karen Silbernagel, a lot of great shoulder tendon physios deserve a lot of credit because they've trained people to go, look, here's good treatment, but it does take time. And switching back to the ACL metaphor, you don't expect them to get back to playing sport with an ACL in 2 weeks. And there was this thinking that somehow tendon injury should get really back quickly. But now with the ICON group having their consensus meetings and things, there's a feeling that tendons need time to repair. And so we've got to have a much more realistic time frame. So I think the surgery pressure is off over 20 to 30 years. The time frames are much more realistic over 20 to 30 years. And the confidence in the physio programs, and when I say physio, it's a good reminder that physio isn't a treatment. I mean, that's what the great physios do, is they assess really carefully. They know the appropriate exercises, which doctors and others don't know, for the different time that the patient is at. And then the skill is in progressing, listening to the patient, judging, testing them and judging them. And that's an amazing skill, which, getting back to the general public, they don't understand the nuance there and how that's a big skill and that you can't get that from anyone else. So physiotherapists are clearly the body specialists in that way. And, that's part of my job is to be advocating that. And I have been, as you know.